This video is presented by Trax WA, Training Centre and Subacute Care. In this scenario, recent amputee Ben is meeting the multidisciplinary team at Sir Charles Gardner Hospital. The team consists of Dr. Ian Wilson, a rehabilitation physician, Beck Heffron, a senior physiotherapist, Emma Willoughby, an occupational therapist, Helke Melville, prosthetist, and Janine Robertson, senior podiatrist. The plan today is to assess Ben's ongoing care and his progression towards a prosthetic limb.
The idea today is to see where we're going to go from here.
Yes.
You're about 3 weeks now since the amputation.
Yeah.
How have things been going at home?
It's been going very nicely. It's nicer to be at home. I've got my missus there to help me along, rather than being in a hospital scenario where I have to press a button if I want to get something, or I'm restricted to the bed rather than moving around. So it's been very nice. It's been more positive being at home.
Excellent. So part of the idea today is to meet the rest of the team. So we've got the team here who's so Beck is the physiotherapist.
So my role from here on is to check that first of all, that you're doing okay at home with your home exercise program that you were discharged from YAR with. So how are things going with that?
It's good, yeah. I sort of train to say twice a day, doing a bit on the bed, and also I've got some exercise equipment at home which I can use to strengthen the arms and legs and all that. So I'm doing that twice a day just to get my legs and all that strengthened up as you and Julie sort of told me to do.
Well done, well done. So part of that is also that we need to make sure that nothing, the joints don't stiffen up. So have you had a chance to lie on your tummy during the day at all? Because that's going to stretch out your hip joint and keep it ready for the prosthesis.
Do that quite a bit. If I'm lying down, I sort of try and get on my tummy and then do some sit-ups as well as stretching this leg right towards the back of my back. So that's been quite good. And I got to stretch it straight forward, and there's no pain at all.
Great, well done. So from here, what we'll do is we'll aim to get you into physio. Yes. So you'll be coming here as an outpatient, and as you're cast by the prosthetist, we'll then be moving on to teaching you how to, first of all, how to balance with the prosthesis, and then how to use it to actually walk and progress you on to being able to walk and do all the activities at home that you want to be able to get back to. Okay, I'll pass on to...
Hi Ben, my name's Emma, the occupational therapist. I met you up on the ward, and I know that you had inpatient rehab at YAR. It's my job to see how you're managing at home and check that everything's okay there. So is everything going okay at home? Are you managing to...
While I was at Aussie Park, I met Bridget. We spoke a bit about what we were going to do at home, where some fittings will go in, some ramps will go in. She went out to the house, took some measurements, and once I got home, Bridget came out again, and we spoke about, I sort of practiced a few things that she wanted me to show her how I did and moved around at home, and she was very happy with what was happening. Took more measurements for the ramps and all that, so she'll be, I think someone will be back this week to put all the ramps in, the proper ramps in, so that I can move around in and out of the house by myself.
And when you do get fitted for your prosthesis and you come back in to see Beck, I will also see you and just help you use that prosthesis in a functional way, so in the kitchen, in a laundry room, in the bathroom, with your prosthesis on, and practicing all those things before you take it home.
Thank you.
Thanks.
Hi Ben, my name's Helke. I'm one of the prosthetists. And I'll be assisting you with your mobility, getting you up and going on your first prostheses. So we first need to manage your fluid and your wound to make sure it's healed appropriately before we get you up and going. on a prosthesis, and then we'll fit and manufacture an interim prosthesis, which will get you started along with working with your physiotherapist with your exercises and gait retraining. And that will take you into as much walking as you can on that style of prosthesis, and then we'll look at fitting you with a definitive prosthesis to get you back to your everyday life.
Great.
And Janine is a podiatrist. She'll explain her role, which is very important.
Okay. I guess as a podiatrist, my area is feet. Obviously, you've lost one foot.
Yes.
Your other one becomes most important to
Absolutely.
you. You're required to be healthy, pain-free. So if you are having any issues with your remaining foot, there to help and resolve any of those.
Yes.
And also just caring for it in the future and on an ongoing basis, particularly since I understand you have type 2 diabetes.
Yes.
Which, with diabetes, there tend to be more risks to the health of the feet anyway. So managing that well, assessing your foot and having a long-term plan to make sure everything stays
Absolutely.
fit and healthy
Thank
in
you.
that regard.
Thank you. Okay.
All right, Ben.
Yeah.
I think it's just to take a little step back. We've met everyone now. It's
Yeah.
just, I suppose at this point we really show what is your goal that in your short-term goals and your long-term goals. Have you?
Well, short-term goal is obviously to make sure the healing is 100% before I go for my long-term goal. My long-term goal is to walk as normally as what I was before this happened, and to get back to work as soon as I can. But obviously, the healing process needs to be 100% before I can get to that next.
It's really important. We have met before, so we know that the goal is to give you a prosthesis. We don't always give everyone a prosthesis. We make sure it's safe, but you certainly are someone who's going to benefit from a prosthesis, and we'll attempt over the coming months, etc., to give you a prosthesis that's suitable for you. It's really important just to know what any background medical history. Do you have any other medical problems apart from the type 2 diabetes?
Not really, no.
No problems with your
Not
arms
really. I get excited a bit. I think that's pretty normal. My heart rate goes up, but then I can control it once I'm sitting down, relaxed again. It comes back down again. So there's no real issue there.
No problems with your shoulders or
No,
normal
otherwise
strength?
there is no. This is the first time I've been in hospital.
All right, okay. The reason we ask those questions is because there is a little bit more effort in walking with a prosthesis. You're a young guy, so you shouldn't really notice it. But we just need to make sure all those boxes are ticked so that we can, go forward and progress with providing with a prosthesis.
Okay.
I think it's fair enough to say we're at that. So we're about 3 weeks, aren't we, since the operation?
Yes.
And it's probably just to sort of butt into where Helke would carry on. The first prosthesis that one normally gets is a training prosthesis. So it's a learning to walk prosthesis, and while everything settles down and you get used to it, you get componentry that is fairly standard. And after that, we make an assessment, probably with Beck, as to your capabilities, and thereafter, one gets a second, what's called a definitive prosthesis, which is more tuned to your level of functioning. Okay. So it's like starting with the trainer one, and then you go on to a more advanced prosthesis. So I think probably the next thing would be just, if it's okay with you, just to have a look at the residual limb.
Absolutely, yeah.
Has it got a dressing on at the moment?
Yes, there is. Yeah,
right.
there is a dressing on.
So let's just have a look
So
at
I'll
that.
take this off.
Some gloves. So it's really important that the surgical wound heals up before we do anything. So it's okay if I just take this off without.
Yep.
Last one off. Okay, well that's healing up nicely. There's still probably a little way to go before we can progress to the next stage. What do you think?
Yes, it's healing well, Ben, but I think I'd like to leave the healing process, give the healing process 1 more week prior to fitting a compression sock. And this compression sock will help reduce the size of your limb and make it as small as we can, ready for a prosthetic casting process.
We don't want it to break down
Yep.
because that will set everyone back, and there's no reason why it should break down. We've just got to go a little bit slowly, because if that heals up nicely and is strong and can,
Yep.
as Helga can say, can
Yep.
have the manage with a socket on it, then we're well on the way to making sort of really rapid progress after
Okay.
that. So I probably think that I would agree. We wait a week. We have a look at it again in a week's time. If it's looking much improved, then we can fit the compression sock. A week thereafter, hopefully do a cast for the interim prosthesis.
Okay.
So as Helga was saying, there are two prostheses. There's an interim prosthesis, which is the learner model, and then after a number of months, when we've worked out exactly
Yep.
how capable
Yep.
you are, which I think you're going to be very capable, we can give you more high-end prosthetic components.
That's good, yeah.
So
No, that's
like-
fine, yeah.
Have you ever seen a prosthesis? Or
No,
would
I
you-
haven't, no.
Would you
No.
like to see
Yeah,
one?
yeah, absolutely. Yeah, I'd like-
Okay, Ben.
Yep.
So this is a pretty normal looking interim prosthesis. So we start with some cotton
Yep.
socks that you
Yep.
pull on to your leg. And then we manufacture a rigid foam liner that you pull onto your leg. This is designed to be able to take some of the impact of your body weight when you
Okay.
walk.
Yep.
The foam liner is quite moldable and changeable, so
Yep.
your leg will change significantly in the first 3 months or so, so we can pack and change the shape of that foam liner.
Yep.
And then this foam liner you pull onto your leg, and then you push the foam liner inside this rigid fiberglass socket. And then to suspend the leg, to get the leg to hold on, we quite often use a gel
Yep.
suspension sleeve.
Yep.
And this is pulled
Oh, yeah.
up onto
Over
your
the leg.
thigh,
Yeah.
and it'll
Oh, wow.
stick onto this
Okay.
thigh component. Okay. So below the socket, we have the standard modular componentry without a cosmetic cover at this stage.
Yep.
And this modular componentry allows us to change the angles
Okay.
between the
adjust those.
socket.
Sorry, they can adjust those little.
So these 4 screws here allow us to adjust the angles
Right.
of the socket in relation to the foot,
Yep.
because as you develop your walking, the flexibility in your muscles will change and we'll need to adjust
Okay.
how the limb walks.
Okay.
And this is a standard interim foot, which
Okay.
will just give you some compression at the heel and flexibility at the toe, which gives you a soft rollover
All right.
in the foot, but it doesn't give you a dynamic response in a responsive foot,
Yeah.
which we will look into further down the track as
Okay.
your walking develops.
So as far as the funding goes for this, the
Yep.
WALSA is the limb service for amputees. So this is the brochure that, and there are 3 providers. So Helga works for one company, there are 2 other companies, and all their
Okay.
company stuff
Yep.
is in there. So you have a choice of who you want. You don't have to stay with them long term. And probably sometime in the future it might all change to the NDIS as well. So you'd be eligible for that. But at this point in time, the initial prosthesis will be provided by WALSA.
Okay.
So if you can have a look at that, and any questions, please feel free to phone the different providers.
Okay.
And then make a decision. My
Yep.
suggestion is to find one that's reasonably close to where you are. And then when we see you to review the wound again, you can let us know who you want to go with, and then we
Okay.
can organise that. It's not a long lead time to get it through the to get WALSA to approve, because you're eligible. There shouldn't be any problems there.
All right.
So just to sum up, so we'll see you again in a week's time.
Yep.
We'll check how that wound is going. If it's all going well and good, then we will, once you've told us who you want to use as a provider, we will get a shrinker put on to shrink it down
Yep.
for approximately a week. And then thereafter, the prosthetist will make the interim prosthesis. That takes about a week to make. and thereafter you'll engage with Beck and start your walking program.
Yeah.
Is that okay?
That's fine.
All
That's
right.
fine, yeah. Thank you.
Thanks very much. Thanks for
My
coming.
pleasure.
down. Thank
Yeah.
you.
Trax WA would like to thank the staff and management at Sir Charles Gardner Hospital for their involvement in this project. This project received funding from the Australian Government.